Good morning and welcome from Houston, Texas. My name is Marvin Atkins. I'm the current secretary of the International Society for Endovascular Specialists and a cardiac and vascular surgeon here at Houston Methodist. We'd like to welcome everyone from around the world. Good morning, good afternoon, and good evening, wherever you're tuning in from. This is a special edition of DeBakey CV Live, where we are meeting up in conjunction with the ISEVS, our Eastern European chapter. And I'd like to introduce my co-moderator of this session, Dr. Palma Shaw. Dr. Shaw is a professor of surgery in the Division of Vascular and Endovascular Surgery in Upstate Medical Center University and the current president of the ISEVS. Palma?
It's a pleasure to be here with all our guests. We have Dr. Ivo Petrov, Dr. Victor Kostash, and his wife, Andrea Kostash, and we can introduce them. I'd like to start off by introducing Dr. Petrov and giving a little bit about his incredible background. He actually graduated from Sofia Medical University in 1992 and was board certified for internal medicine in 1999, then cardiology in 2003 and angiology in 2014. He specialized in invasive cardiology and endovascular therapy at the Institute of Cardiology and Cardiovascular Surgery of Favaloro Foundation in Buenos Aires, Argentina, until 2001. Since November 2012, he was in the position of medical director of the head of cardiology and angiology in the Department of ISEVS City Clinic Cardiovascular Center, Sofia, Bulgaria. Professor Petrov's academic career started in 1998. And he was appointed as an assistant professor, then associate, and now professor of cardiology at Sofia University Faculty of Medicine. He's one of the pioneers of modern endovascular therapy, founder and president of the Bulgarian Society of Endovascular Therapy, and the first president of the Balkan chapter of the International Society of Endovascular Specialists. He has particular interests and achievements in the treatment of complex cases of aortic aneurysms and dissections, transcatheter aortic valve implantation, interventional treatment of stroke, left main and bifurcation coronary lesions, total and subtotal carotid stenoses, renal denervation for resistant hypertension. His team was in fact the first in the world to successfully treat a child with type B dissection by an endovascular approach and among the first to treat total endovascularly a patient with acute type A dissection. He's the past president and board member of the Bulgarian Society of Cardiology and current president of the Bulgarian Resuscitation Council. Welcome, Dr. Petrov.
Thank you very much for your very, very kind introduction. And it's our pleasure and honor to touch the expertise of people like you and all our colleagues from the International Society of Endovascular Specialists. Definitely we are following you and your expertise and your practice in this very, very important field. Endovascular therapy is probably one of the fastest developing field of the medicine because the problem of cardiovascular disease is so huge. Probably this is the reason of the interest of patients and physicians toward endovascular field is so high. And we have to thank you about supporting us in this mission. Thank you.
You're welcome.
Great. I'd like to take the opportunity to introduce Dr. Victor Kostash. He is the current chief of the Department of Cardiovascular Surgery in Bucharest at Sanador Hospital, which is the largest hospital in Romania. Dr. Kostash has done his residency in the university hospitals from Toulouse and Grenoble in France. And after becoming a specialist in cardiovascular surgery, he performed a one-year fellowship in Canada and then worked for 5 years as a consultant cardiovascular surgeon in Annecy, France, where he started the first TVAR cases in that center. In 2013, Dr. Kostash opened the first private cardiovascular center in Transylvania, where he started the first minimally invasive cardiac surgery program in the region and performed some of the first endoscopic mitral and aortic valve surgeries. He also performed the first EVAR and TVAR for ruptured aortic aneurysms in the region. In 2017, he organized the Eastern European chapter for the International Society for Endovascular Specialists in partnership with Professor Ivo Petrov from Bulgaria and started the conference East Meets West symposium that has reached its 7th edition this year, and we're going to hear a lot about that conference. It's one of the most important cardiovascular meetings in the region and endorsed by our society. In 2019 and 2020, Dr. Costas was the health minister in Romania. We'd love to hear about that, and initiated important reforms for both patients and doctors there. Since 2022, Dr. Costas has been professor of cardiovascular surgery at the University Titu Maiorescu in Bucharest and coordinates the residency program at the medical school and Sanador Hospital. Victor, we're so pleased to have you with us here. Thank you very much.
Thank you so much for your invitation. It's a privilege to be here with you.
And it's my unique pleasure to introduce a very good friend of mine and someone I admire so much, Dr. Andreea Costas, who is the wife of Dr. Costas, who we've just heard about. She is currently a chief resident in the Department of Cardiovascular Surgery in Sanador Hospital, the largest private hospital in Romania. In 2014, she joined her first cardiovascular surgical team and started working as a part-time attending surgeon, even when she was in the first year of her medical school. After performing 2 clinical rotations in vascular surgery in Ireland, she returns to Romania, where she was part of the team that performed the first EVAR and TVARs for ruptured aneurysms in the country. Her interest extended also into cardiac surgery as she integrated into the surgical team that performed the first endoscopic mitral and aortic valve replacement repairs in Transylvania. In 2017, she became a member of the ISEVS and started to participate in the organizing committee for the East Meets West Symposium, which is the ISEVS Congress of Eastern Europe, now in its 7th edition. In 2021, Dr. Costas obtained her PhD in surgery as a part of several European scientific grants and co-investigator in clinical trials of new endovascular solutions for aortic dissection and aortic aneurysms. Since 2022, Ms. Costas is also the director of the Sanador Cardiovascular Operating Rooms, coordinating surgical activity in the largest and most modern center in Romania. And also, she's a lovely mother with 2 sons, and we'll hear more about how she juggles all of that with everything else she's doing. Welcome.
Thank you very much, Palma, for inviting me being part of this show. It is an interesting experience for me to be here, and I have to admit that I have a little bit of emotions. I am very happy that I met you, and I hope I will be at your level today to be able to share our experience and mine as a resident in my final year. Thank you very much.
Perfect.
Great. So for this special edition of DeBakey CV Live for the ISEVS, we'd like to highlight some of the collaboration, global collaboration with our Eastern European chapter. Can you guys tell us exactly how the chapter started? Give us some history.
Ivo, do you want to start off?
Yeah.
Yes, thank you for the opportunity. In fact, we started a relatively long time ago, approximately 15 years ago, when Ted Dietrich, our teacher and the fact one of the biggest pioneers in endovascular therapy, visited Bulgaria and especially my hospital. In that time, it was my previous hospital, Tukuda Hospital. It is still the biggest hospital, private hospital in Bulgaria. And in fact, I met Ted Dietrich during a very interesting MEET endovascular conference in Cannes, France. And during this meeting, in fact, it was thrilling for me to meet this giant of the medicine and the endovascular intervention. And in fact, he was one of the main reason and inspiring person for us, for my team, to create our local comprehensive cardiovascular intervention center. And nowadays, probably and definitely because of him, he in fact assisted the inaugural meeting of my hospital, my present hospital, and this collaboration between the specialties that he introduced in the ISEVS was one of the examples for us how to do it. And to be fair, it's a principle of ISEVS as a society. And for me and for my colleagues and for all the specialties is very inspiring, this collaboration, working together. In fact, this is the most important for the final success of any endeavor and any treatment in the medicine. And we have to be, and we are thankful for the interest of the board of ISEVS toward our region, and it's absolutely by purpose. I know Victor named his meeting East meets West. So in fact, this is crucial to work together between East, West, South, North, and to be together in that. And with Victor, my friend, and Andrea, as friends and as colleagues in this endeavor, in fact, we are working together since long time ago, but ISEVS was the particular reason to be together in developing the knowledge and the practice of endovascular intervention in the field of Balkan area and East European region. So this is in short the part of the story, but the story in fact is going on. So we are continue to be in the same carriage together with you, Palma, and together with Victor and Andrea. And this is the beauty of this collaboration. For that, I'm very thankful that ISEVS is increasing with your presidentship, increasing the interest of ISEVS toward Bulgaria. Pioneers like Donald Treat, Jack Busquet, Zvonko Krajzer, definitely Alan Lumsden, all these people are very important for us. You are very important for us and for our people as an example how the things has to be done. Thank you.
I think you're muted, Palma.
Victor, what's your perspective on that?
It's Ivo covered it very well. So the ISEVS was like the perfect blend for Eastern Europe, because it's a society that brings peace, that brings together cardiac surgeons, vascular surgeons, interventional cardiologists, and this is what helped us developed intensive endovascular programs in our country, in Romania. So as Ivo said, we had the privilege to have in Romania ISEVS founder members and presidents like yourself, Ronnie White, Alan Lumsden, Jacques Busquet. And when we started East meets West with special thanks and help from Ivo, who already had like 7 years experience. So we started a little bit later the conference in Romania in 2017. We already had a group of friends and renowned interventional specialists that came to our country to help without hesitation and pushed ourselves forward. So thanks to Ivo, we started a lot of interesting endovascular technique in the country, like ablation for hypertension, fenestrated EVARs. We started custom-made complex aortic procedure with Kiki Young. We had Rodney White coming to Romania, and we did complex dissections using multi-layer technology. And all this and the international conference pushed the whole country together. So the initial brilliant concept of the ISEVS of bringing not only people, but all these cardiovascular related specialists together was a great help for doctors and at the end of the day for patients in Eastern Europe.
That's wonderful.
And it seems as a trainee, Andrea, do you feel, I think you're just so lucky to be kind of learning from cardiology, interventional cardiology, CT surgery, vascular surgery, and it's just like a lot of things you can draw from. How do you feel about that?
Well, I started joining ISEVS in 2017 when I started my residency for me, of course, it was a very huge privilege to have access to all these wonderful surgeons and people from abroad. I remember in 2017 when we had our, I think, first or second edition of our meeting, I met Dr. Buckley and his wife, and I remember they were very supportive of us. It was a kind of huge privilege for me to meet all these pioneers. I'm sorry, I have a little bit of nervous. So I had the huge privilege to learn a lot from Dr. Petrov, from Kiki Young, from each of them who came to teach us what we do not know exactly. And also we are trying to do this in our country because we just started with these techniques. I refer to the public hospitals. I had the privilege to know more about endovascular because I was working all the time with these pioneers.
I think the nice thing about ISEVS is that, as you've all mentioned, these are giants in the field. I mean, these are people who came from Ted Dietrich down, just so many, who to a young trainee or a young surgeon would feel unapproachable and well out of their depth. And ISEVS allows proximity and contact to the different specialties, as you've described.
Exactly.
I think I'd like to kind of highlight, I guess, some of the vision of Ted Dietrich from back in the day that, you know, it really has blended and merged a lot of the different silos that we're typically in our different specialties. Ted broke those barriers to bring all the different specialties together in one society, and that we can learn from each other rather than just staying in our individual specialties and just teaching ourselves. You know, a great example of that would be the recent procedures that people do for basilica procedure for TAVR. So where you take a wire, you use electrocautery, and you split a leaflet so that you can do a valve-in-valve TAVR. Well, that same technique was then applied to type B aortic dissections to basically use as an endoseptostomy. And so basically we can learn from each other for the benefit of patients. Just an amazing society to be able to learn from each other and get out of our silos and learn something different.
And each of you have done that with your annual meetings. I'd love to hear more about, I mean, how did you even dare to create the meeting, and then how did it evolve, and what were the challenges you faced, and what have been the benefits of running a multinational meeting? Each of you have one. Ivo?
In fact, our Bulgarian meeting that started like a Bulgarian workshop of one of the companies, I will not mention the name of the company, but it started as a national workshop of one of the companies to teach people how to use materials in endovascular field. It was long time ago. It was, in fact, 19 years ago. We started with this workshop, and the next year, we decided to make really a multidisciplinary national conference. And this was in fact, the initial really national meeting, the Bulgarian endovascular course. And because we attracted after that participants from all the surrounding countries, we decided that the B from the acronym of the BEC has to be not Bulgarian, but Balkan. And on such a way, the BEC Balkan Endovascular Conference or the Endovascular Academy became more or less a regional meeting to teach people. Why teach? Because it's a life cases based meeting. So we are performing head to toe endovascular intervention, life cases demonstration, hands-on simulators, and of course, some science. So trials, publications, sharing, and so on. It's a very nice gathering of friends from different specialties. All the specialties that have something to do with endovascular interventions, cardiac and vascular surgeons, cardiologists and angiologists, neurologists and imaging specialists, and even pulmonologists, gastroenterologists, because in fact the vascular pathology is involving all the segments of the human body. And because of that, people, specialists from all the different specialties in the medicine, they can learn something about endovascular options for intervention. But endovascular is not only the only possibility for the patients. The hybrid option is also discussed, the possibilities of vascular surgery, hybrid and totally endovascular. So this is more or less our meeting. We mentioned in the beginning that since the next meeting in Bucharest, in Romania, and next meeting in Bulgaria, in Sofia, we are going to interchange live cases from Bucharest to Sofia and from Sofia to Bucharest. So all the people with interest about endovascular interventions are invited. Our meeting, the BEC, Balkan Endovascular Course, will take place in Sofia, Hotel Hilton, the last weekend of October, 25th to 27th. It's Friday, Saturday, Sunday. So hopefully, again, with the support of the companies, the pharma industry, and all the people from different specialties, it will be, again, with the participation from all over the world, it will be a very interesting and very successful meeting.
That's great. Victor, how large has the meeting become?
In fact, the last year, we had 400 participants.
Wow, that's great.
And Victor, you run your meeting, and I really enjoyed attending it last year. I highly suggest others try to get there. It was such a beautiful city. And I love the perspective that you're a cardiothoracic surgeon and you've so embraced endovascular. And I don't think all cardiothoracic surgeons, at least in the US, are doing as much endovascular work as you do. So I think you have a very unique perspective, and then you translate that into your incredible meeting. So maybe you can comment from your perspective and your background, how that all evolved.
So thank you, Palma. So our conference, ISEVS West, it's very complementary with the conference of. So we complete each other with the conference of EVO. So EVO is focused on towards some parts of the endovascular field, and we are more focused on the other side, more on structure, heart, and also endovascular, aortic, minimally invasive, valvular technique. So last year in 2023, we had the privilege to have yourself there, and also we had the privilege to have Professor Alain Cribier, the inventor of TAVI, who was there, also with the great faculty Rodney White, Jacques Bousquet. Usually we do minimally invasive, more valvular cases, aortic, mitral, and last year we did a complex TAVI case with a new type of valve, which was commented by Professor Cribier. So our conference brings together, of course, a lot of people from Romania, from all over Romania, and from other countries. And for them, it was, can you believe it was such a privilege to see a TAVI case commented by the inventor of TAVI. So every year we try to do something special. And when we started this conference in 2017, when I told you, we tried to bring together the most prominent vascular, cardiac surgeons, interventional radiologists from the country. So ever since we started, I had on board Professor Moldovan, who is my co-partner and friend. And at that time, you remember, I was in Transylvania, in Sibiu, and Professor Moldovan was the leading cardiac surgeon in Bucharest. Right now, we're both in Bucharest. And this, I told you, our meeting was like copied on the ISEVS principle on friendship and collaboration. And this friendship built also new techniques and endovascular procedure in the country. So, for example, as you mentioned, in Romania, you realize we are a little bit different. We cardiac surgeons, we do a lot of endovascular work. We do a lot of heart cases, but we do a lot of endovascular work like TEVARs, fenestrated EVARs, a lot of TAVI cases. So I think in Romania, at least half of the transcatheter valve procedure are done by surgeons. So I remember once, 8 years ago, I read a paper written by an American surgeon about TAVI. It was something like, the train has left the station, how can we catch it? Well, we were already in the train in Romania. We never left the train.
That's
And
great.
Andrea, can you comment in the U.S. about maybe almost 20% of board-certified vascular surgeons are women, at least, and many of us are active in the Society for Vascular Surgery and other societies. But from your perspective, where do women stand with respect to, is it a significant minority? Is there an increasing number of women? Are they increasing in interest in vascular surgery? How are they getting more engaged with this meeting, for example? What are your thoughts?
Yes, in Romania nowadays there are more and more women who start the training in surgery, in vascular and also cardiovascular. This year we have 3 new women and only one boy, you know. I think in Romania, the doctors doesn't know much about the endovascular part. I'm meaning again in the public hospital, because, for example, in Iași, I've heard that only 2 boys wants to join the endovascular part because they are afraid of radiation and all of these second effects. I'm trying to tell them that this is the future in my perspective. I like very much the endovascular part, but I think we have to show that this is the new era which is coming, and we are very well supported. I mean, for example, I'm an exception because I'm working with my husband, but I have seen in other hospitals that women are very strong. They have a very strong determination in doing this, and they are more focused on this part.
So as a woman, I had 2 children when I was a new young attending. It is a lot of work, and we become absolute expert multitaskers. So I'm very good at organizing things as a result, just like this webinar, but and doing society work and things like that. And I think that the radiation safety aspect is very important for women, but I think we've shown numerous publications that it's very safe if you use proper technique to have children and do these endovascular cases. And the European Society for Vascular Surgery Radiation guidelines have come out making good recommendations about how to protect ourselves. So that's great.
Andrea, can you describe to us kind of your training paradigm? How is it there? From everything from high school all the way up, what's a typical path to get to where you are?
Okay, so in Romania we have 6 years of medical school, and after that we have to pass a huge exam, and then we can choose what we want to do. I have chosen vascular and endovascular, which involves 5 years of preparation. I started in 2017, but I had 2 breaks with my children. In these 5 years of the training, you have to do most of it open surgery, like general surgery, vascular surgery, and started with 2017. In our curricula was also introduced endovascular surgery.
And is most of the training done there, or do people try and go out to different countries, different experiences?
Sorry?
Do most people stay there, or do they go to different countries for different experiences and exposure?
Most of them are doing the whole training in Romania, but I have some colleagues who does 6 months experience abroad, because it's a little bit difficult to be recognized here in Romania, even if you are a resident and you go, for example, in France to do 6 months of vascular surgery or cardiac, you have some problems on recognize this part of the fellow.
Victor, can you describe some of your training experiences outside of your training? International training experiences?
When I finished medical school, I really wanted to do a cardiovascular surgery. So I passed my residency exam in France. It was a very tough exam, and then I started the training in France. So in France, like in Romania, for opposed to UK or USA, you're trained as a cardiovascular surgeon. So you can do either cardiac or you can do cardiovascular. So I really tried to do both cardiac and vascular. And when I did my training, endovascular surgery was emerging. So it was very funny because when I was in my cardiac cases, my mentors in cardiac surgery were telling me that all these guides and catheters and implants are rubbish and they have no future. And when I was doing my vascular training, my mentors were telling me then this is the future. And actually, I believe it was the future, and I really struggled to get to stay on the top and always be around when a new technique was introduced. And France is the country that started TAVI, so I was there from the very beginning. So I was lucky to when I finished my training to be able to do TAVI and to be able to do EVAR and also to be able to do complex cardiac case, but also to put a peripheral stent. So this helped me a lot. And when I came back to my country in 2013, so after 12 years of training and then senior work as a surgeon in France, when I started my program, I introduced these techniques, and this is why I did so many first-time cases in Romania, because when I came back to Romania, people were back then, so I'm talking about 10 years ago, doing more traditional cardiac surgery than they are doing now. So right now, the practice in Romania, and especially in private hospital, is very diverse. So most private practices have developed next to the traditional cardiac program, a strong transcatheter program, an endovascular aortic program, and if they don't do it themselves, they have a vascular surgeon doing endovascular cases.
Well, I have to ask the question that everybody wants to know. How did you two meet? You and your wife?
In the operating room.
We met in the operating room.
I was a student that time, and I remember we have been his first generation of students in CBU, and I wasn't lucky, but a colleague of mine was asking me if I want to join cardiovascular surgery because she can't go that day. So I went to Victor's surgery, and I remember I told him that my dream is to see cardiac transplantation that time, and I wanted to be a cardiac surgeon, but I've chose in the end vascular and endovascular surgery, and I do not regret it. I think this is the future, and I like very much the endovascular part.
Perfect. Do you guys do cases together?
Short story.
Do you guys do cases together?
Of course.
Oh, that's great.
Yeah, we do many cases together, and also Andrea works with another colleague of mine.
Perfect. Yeah, my wife is an OB-GYN, and I don't want to do any cases with her.
I think so.
So, Ivo, I know that you mentioned that there was a female leader that you worked with, Julia Horgova. Maybe you and then Victor
Definitely.
can talk about what aspects of what women leaders you admire, and what are the qualities of those women that you think have gotten them to where they are in a male-dominated field? Because there's a lot of women that are watching, that I interact with, that would love to know what is the secret to moving up in the man's world.
To be fair, Professor Georgova, she's my first teacher in interventional cardiology. In fact, she was the most inspiring person for me to jump into the interventional cardiology. It was long time ago. It was in 1993 when she, in fact, invited me. I was a volunteer during that time in the first comprehensive cardiovascular center in Bulgaria. And in fact, she inspired me to go into the interventional cardiology. During that time, it was considered very dangerous because of the X-ray you mentioned already. But I saw her, how she in fact, together we have done the first primary PCI intervention in myocardial infarction, first bifurcation and left main interventions. In fact, to be fair, her inspiring me about writing several papers about chronic total coronary occlusion intervention, and my presentation during the World Congress of Cardiology and my meeting with Professor Favaloro was the most important step for my career to go further. And during this conference, Professor Favaloro invited me to go to Buenos Aires, Argentina. That in fact is the homeland of my father. I have a double citizenship, Bulgarian and Argentinian, because my father is Argentinian. And I was a lucky guy to meet Professor Georgova, and after that to meet and to learn from the pioneers in the endovascular field like Professor Favaloro, Juan Carlos Parodi, Julio Palmatz, who invented the first stent, Hugo Londero, my teacher in the Favaloro Foundation. And like Andrea and Victor mentioned, for the people from our region, it's quite important to go abroad into the most comprehensive and most sophisticated centers like in US, in Argentina, in France, in Germany, in order to be trained, and after that to come back to the homeland in order to show all this what they have learned. It's not a secret that there is a limited reimbursement, limited financement of all these modern methods, because all of them, they are very expensive. And because of that, people like us, we are starting from the first interventions in the countries. After that we are struggling with the institutions for reimbursement and so on. It's a tough, but it's worthy to do it. It's worthy to struggle and to make an effort in order to make all these modern hybrid and endovascular interventions to be on disposal of our patients, because definitely this is one of the biggest killer in our countries. And because of that, we are happy to be trained by people like you and to transfer all this knowledge to our colleagues.
I think that's the beauty of the meetings that you both hold, that you're allowing folks to see different techniques without having to take time off to do a training paradigm, move away from their home country, but in a short period of time be able to pick up techniques that they can use to treat their individual patients when they go back home. And that's the beauty of cross-collaboration amongst all these societies.
Indeed.
Victor, I know you have some strong collaborations with some women leaders, even in your own organization. Can you comment?
Indeed, Palma. So, well, the first very strong woman leader I met was my grandmother, who was an OG surgeon, a very successful OG surgeon, and head of her clinic. She used to work in the same hospital with my grandfather, who was the chief of surgery. but she was very strong, a very dedicated surgeon, and she was a person who was impressing everyone. And so in Romania, we were like used to have a lot of female doctors. I think probably it was the only good thing from the communist period, because they were promoting equally both men and women. So I think it was like back that day, it was like 50% parity, even in surgery. Huh? I remember my grandfather had a lot of female colleagues. And when I went back to France for studying, I was surprised to find only one female surgeon in the whole university hospital. Probably it is more macho word in France. And when I came back to my country, I found again strong leaders, female doctors. So, for example, this hospital, Sanador Hospital, who is like example of good medical practice in the country, being the largest and with the more complex specialties, even with the transplantation program, was founded by a female doctor, Doris Andronescu, who founded this hospital 20 years ago. She's still the manager of the hospital, and due to her involvement, I can say day-to-day involvement, she's like here at least 10 hours a day, every day. Things are perfect and are kept on the medical line we all wish. And I think I used when I was Minister of Health. It was a few years before being a Minister of Health. Some people introduced hospital managers that should be economists, lawyers, and stuff like this, like it's compulsory. Hopefully nobody forbid doctors for being hospital manager. And I read recently some papers that at the end of the day, this was a paper from Harvard. Apparently, doctors are the best hospital managers, because they can. It's easier to learn a few bases of economics and law than to learn medicine. And Sanador is a very good example with Dr. Doris Andronescu.
That's wonderful.
I was going to ask, what do you think the future is? Where are we going with AI and all of these new modalities? It's 2024. Where will we be in 2034? You are visionaries. Let's hear it.
So I think we are going to have some specialties that are going to be more implementing AI rapidly, like radiology. I think we are going to need in the future more interventional radiologists than traditional radiologists who read CT scans and MRIs. I think AI is going to help a surgeon on the diagnostic level, and is going to help us spending more time in the operating rooms, maybe relieving us also of some administrative tasks and bureaucratic tasks that should be taken over by AI. But it's hard to me to imagine in 10 years, for example, to see, for example, a robot like Da Vinci being operated by AI. So I think surgery and all type of surgery, open surgery and vascular surgery, robotic surgery, still has a lot of decades in front before shifting to AI.
Ivo, where will we be in 10 years?
It's quite difficult to predict, but I think that we are living in a jump. In fact, we are witnessing a jump in the medicine. And this jump will make the future medicine absolutely quite different. Probably the beauty of everything is that finally the human decision is the most important. So because nowadays the contemporary medicine is more and more based on imaging, you know, guys, vascular surgeons or cardiologists or cardiac surgeons, without imaging, we cannot do anything. And nowadays, planning, simulation, artificial intelligence-based software that is, in fact, improving quite a lot the imaging and the precision of imaging. All these are very, very important even nowadays. And there is increasing experience exactly in this. Artificial intelligence, for example, my team, my collaborators and myself, we are participating in a very interesting project about thermography for vascular and cerebrovascular pathology with the guys from the imaging department. We are performing very interesting. In more than 1,000 patients, we saw impressive results and impressive pictures. So based on robotics, like Victor mentioned, artificial intelligence, the human has to rule the machines in order to help the patients. In fact, this is very important, to put the technology and all the advancement in the science to be in service of the human medical and medical humanism. And this is probably the most important to keep in our mind when we are treating and when we are looking at the future.
That's great.
Thank you.
What advice would you have for young trainees who are considering going into these different fields? If you had to go back in time and talk to yourself when you were 20-something years old, what would you say?
In fact, this is very important because it's quite easy now. One of my teachers was telling us a little upset approximately 15 years ago that the present cardiology became echocardiology. So echocardiology. And nowadays it would be quite easy for our young generation colleagues to jump directly in the modern medicine and to skip the basics. For me, still the basics are very important. So a particular medical doctor, before being endovascular specialist, has to be, first of all, he has to be MD, medical doctor. He has to know very well cardiovascular anatomy, because even with the present imaging and artificial intelligence imaging, one has to know very well the cardiovascular anatomy. And these people, they have to know that they have to be medical doctors, after that vascular surgeons or cardiologists or angiologists, and after that they have to rely on the help of the robotics and artificial intelligence and so on. Because in a difficult situation, not the artificial intelligence, the medical experience and the medical knowledge will help him and or her to escape from a difficult situation. So this is very, very important.
Victor, your perspective?
So I think what I have learned from the past, and that what I always teach to my young trainees is to keep an open mind, to keep a very open mind, and to always be on top and to learn every new available technique, because all this technique will develop someday. So I strongly think that modern cardiovascular specialists need to acquire both catheter skills, both open surgical skills, both robotic skills, and this is how they will stay on top, and this is how they will survive to changes in our specialty. I remember when I started, cardiac surgery or cardiovascular surgery was like synonym to 6 hours per case, a lot of complications, bleedings, I remember Vascular, my mentors in vascular surgery were telling me, "Oh, Victor, why do you want to do cardiac? Do only vascular, because cardiac is so boring. You just do full sternotomy and change a valve or stitch a graft on the heart, and it's always full sternotomy." Actually, our specialty is right now so diverse. You can do mini thoracotomy. You can do a complex transcatheter or a complex endovascular procedure. You can do a carotid. You can do so many things, and this has changed dramatically in the last 20 years. And at the end of the day, all this change was in the benefit, in the patient's benefit.
Andrea, what advice would you give to young medical students, and especially female medical students, from your perspective?
Okay, for the students, because I think I'm pretty young yet. So I think, as Dr. Ivo said, that the base is the foundation, even if the endovascular part evolves very fast. And for me, I love it much more than open surgery nowadays. I think it's important to know open surgery, because if you don't have these skills, every time we had a problem, what should we do? To call someone else to come and do for us what we don't know or what we should have known. And I think this is the most important, to have a very good base and to be human, first of all.
That's great.
So what specific challenges do you anticipate going forward? I know we talk about, there's a couple of things, like we have a lot of competition of specialties, whereas I think you found a perfect match. I mean, you guys just all work together and it sounds great, but there is competition between the specialties. And then there's also challenges with the government and funding and things like that. And I know Victor has first-hand knowledge from being the Minister of Health, what that means. Can you comment?
So I became Minister of Health at the end of 2019. So after managing a successful reform for residents who were back then tied to some only very few professors who were able to coordinate residency training in Romania. For example, I remember there was one guy who was coordinating residents who had 147 residents in 2019. So how can you coordinate 147 residents in your specialty? Wow. So the core of this reform was to organize the Romanian system like the French system and like the system in America, where a resident can go also in peripheral hospitals, in private hospitals, in military hospitals in needed, and they can learn from, they can do rotations with many doctors who have a good practice. And this is validated by a university that coordinates the programs of not one person, one university. So this was a very successful change, which was saluted by the majority of people. That usually reforms are not saluted by everyone, but this was a very important reform. And then COVID-19 stroke at the beginning of 2020. So I was only 2 months in my term of the Ministry of Health. And what we did, because hopefully this is how we have evolved and survive as a human being. We have the tendency to forget things. In 2020, we had very little information about the disease and what was the particularity of Romania. So when other countries like France, Germany, UK, Italy already had thousands of deaths, we had very few cases because we reacted very strongly and effective from the very beginning. So what we did, we implemented immediately travel restriction from China and from all the country around us, and we closed the country. So we had like the first case 3 months behind everyone, and we prevented a lot of deaths in the first epidemiological wave. And during this period, we managed to implement some important cardiovascular programs, which took, however, a few years to be implemented. So I had to leave the Ministry of Health. So the COVID pandemics had to erase before these programs were implemented, like the MitraClip and the TriClip program. What we still have a huge problem in Romania. So Romania is the country with which is number one in Europe, unfortunately, in terms of cardiovascular mortality, because we are financed with the DRG system. You know, the DRG system is a very good financing tool. Unfortunately, the fixed parameter which is included in the DRG system in Romania is 10 times less financed than in Germany or France, for example. So this is there is a big lack of financing of cardiovascular case. We tend to a little bit compensate this with some special cardiovascular programs like the TAVI programs, the EVAR programs, but this is where the country has to work to finance more the DRG system to help more people.
That's wonderful.
Perfect example of why we surgeons and physicians have to become not only active in the administration of our own hospitals, we have to also engage our political environment and advance the technology that we need to take the best care of patients. So.
As you can see, we are.
If I just to underline what Palma just said. So I think it's very important for us doctors to involve in, and Ivo is doing this in politics and in decision making, because what I've seen, and I've seen it from the very high level and also at the European political level, ministers tend to be political figures, and they tend to break under pressure and to take when they will have to choose between two decisions, they will take the easiest, the political, the demagogic solution. So when I was there, I always took the medical solution, even it was more unpopular. And I remember I was laughing before the prime minister and say, for me, when you're going to dismiss it, I'm going to be back to my operating room. I don't care if I'm not doing a political career. And this is how also Ivo sees this, and he does a great job in Bulgaria with it.
Victor, sometimes I think Romania and Bulgaria, we are twins. Because we are meeting the same challenges and the same endeavors in this field. So it's we are coming from the communist background, and it was quite difficult to escape from this period. And thanks to you, Palma, people like you, in fact, we can do that. So. I think, but it's very interesting. I think we are living in the era of collaboration and fusion in the medicine. You mentioned already about competition. I think we nowadays the collaboration is more important than competition. It's you know that like you mentioned, both of you mentioned that surgeons are becoming more and more minimally invasive, and cardiologists are becoming more and more invasive. And in fact, this fusion of way of thinking and of course of collaboration is very important to be on the daily practice in order to have good result in every single case. And Victor mentioned already, we do it, and we have to continue struggling with institutions, politics, and so on in interest of our patients, because funding at the end of the day is very important. So the modern medicine cannot be done without good funding and good financement. And nowadays, trying to be part of the modern world, both countries, we have to do that. We have to follow the good practices of countries like USA, Germany, France, and so on, not to mention all the modern countries, but we have to follow these examples and this practice.
So we're running short on time. We have to just wrap up with some closing comments. Do the three of you have any closing comments you'd like to make?
So we are very grateful for the opportunity to be here with you, Palma, and it's a privilege to be in this great cardiovascular show. And it's the very first time. I think it's a unique show in the world, and I think it has to be seen by many people. And I think at the end of the day, we are also grateful to the ISEVS to making this possible, and we are very grateful to the people that founded the ISEVS, a special. We are already always think at Professor Dietrich, who is not here without anymore, at Ted Buckley, who is not with us anymore. And we are glad, Palma, that you took the presidency and you're pushing things forward. And we're all fighting to make to keep the principle of ISEVS strong and modern.
Ivo?
Absolutely joining of what Victor is saying. In fact, we are lucky. We are lucky, in fact, of having the support of ISEVS in our practice, in our training. And Palma, thank you very much for your initiative. It's crucial for us. It's absolutely very important, your support. Thank you for that. We have to follow the pioneers, and definitely the ISEVS is one of the scientific society that is emphasizing on modern methods of treatment, of collaboration between specialists, and this pioneering work, I would say, light for us is very important. And spreading the idea, the principle of endovascular for different specialties is very, very important. And like it's included into the name of ISEVS, this is the most important. This is the symbol I mentioned already, that endovascular is probably one of the fastest growing and developing part of the medicine. And this is thanks to people like you. It's definitely in dispose of many people and many patients worldwide. And thank you for your support, and hopefully with your help, the news about our meetings, local meetings, will reach more people, and more people on a regional level will visit these meetings, because they are very important by training and educational point of view.
Andrea?
Thank you very much, and congratulations for making this possible. And thank you for inviting me also. It was a huge opportunity for me being amongst you.
I want to thank you, and I want to thank Marvin, our secretary for ISEVS, for everything that he does and his participation. And this has just been absolutely incredible. Marvin?
Yeah, I'd just like to thank everyone for joining us today on behalf of DeBakey CV Live and the Executive Council of the ISEVS. Thank you very much for joining us today.
Have a great day.
Thank you. We look forward to doing this in person.
Have a nice weekend.
Yes.
Bye.
Have a nice day.
Bye.
Thank you.